Yes. The key family practices are first one is promotion and of G&D of the child. Growth and development always we should promote in the form of breastfeeding, ensure enough micronutrients such as vitamin A, iron, zinc, and all. Promote mental and social development by responding to a child's need for care and by playing, talking, provide a stimulating environment to the baby. Then disease and prevention in form of hygienic practices protect child in malaria. Also the endemic diseases. Okay, by using the insecticide impregnated bed nets, provide appropriate care for HIV, AIDS, especially orphans and all. Appropriate care at home in form of a breastfeeding, appropriate home treatment for infections, protect children from injuries and accidents, prevent child abuse and neglect, and involve fathers, very important, involve fathers in child rearing and reproductive health of a family. These are simple measures yet very important. Then care seeking outside the home, recognizing when the sick child needs management outside the home and seek care from appropriate providers. Complete a full course of immunization before first birthday, very important. Follow the health provider's advice on treatment, follow and reference. Then ensure that every pregnant woman has adequate antenatal care, seeks care at the time of delivery and afterwards. So every antenatal woman, every pregnant woman should take the advice from the health care providers whenever she is in need. Then the IMNCI plus the objectives are increase coverage of skill care and birth. Then implement a newborn and a child health packages of preventive and promotive as well as a curative interventions using a comprehensive IMNCI approach at all levels and at the household levels in rural and poor peri-urban settings. It has at least 125 districts. Okay, so where we should have the universal immunization program and strengthen, also augment the existing services in areas where IMNCI is yet to be implemented. Then what IMNCI plus adds? So it adds IPD, okay, inpatient care component for facilities to ensure the effective care. Also, it IMNCI package not covers a vital care of newborn at birth in home. Okay, so the facility and settings and at home where the IMNCI package is not there, where the IMNCI plus acts. Okay, it approach including immunization, counseling, and also the comprehensive immunization plans. Then we have national immunization program, which is what is it? Very important, must know, always ask in exams. So the national immunization program includes the immunization of under 5 children, also the pregnant women. So the majority of the vaccines are under 5, followed by a single vaccine at the age of 10 and 16 years and pregnant women's vaccines. Right? So at the birth, as all of you know, that we advise BCG, 0 OPV, also the hepatitis B vaccine, followed by at the age of 6, 10 and 14 weeks, we advise OPV 1, 2 and 3. Oral polio virus vaccine. We advise 6, 10 and 14, OPV 1, 2 and 3. Also, now we give Ruta 1, 2 and 3, which is also oral vaccine. OPV and Ruta are the oral vaccine. We give 2 drops of OPV and we give 5 drops of rotavirus. So rota 1, 2, and 3 is also included in at the 6, 10, 14 weeks. Along with that, we give along with OPV, we give IPV1 and IPV1 at the age of 6 and 14 weeks. We give pentavalent 1 to 3 at the age of 6, 10, 14 weeks. Pentavalent is the intramuscular injections. IPV is also intramuscular injection. Along with that, we it is now introduced pneumococcal conjugate vaccine. Pneumococcal conjugate vaccine PCV1 and 2 we give at the age of 6 and 14 weeks. These are the newer vaccines, okay, which are introduced recently. Though it is mentioned at being introduced, it is right now, it is there, okay, already introduced. After that, at the age of 9 months, completion of 9 months to 12 months, we give MR1 vaccine and PCV booster. Okay. Pneumococcal conjugate vaccine booster we give at the age of 9 months. JE vaccine we give when we give JE vaccine we give JE vaccine we give wherever it is required. In Maharashtra, it is not required. In South India, it is required. So Japanese encephalitis disease, wherever it is there, in those states only we give it. Right? So in Maharashtra, JE vaccine we don't give. In Karnataka and all we give. Right? So MR2, which is booster of MR, we give at the age of 60 to 94 months. So at the age of 60 to 94 months, we give the MR2 vaccine, we give a DPT booster and OPV booster. Booster 2 of DPT, we give at the age of 5 to 6 years of age. Then tetanus vaccine, we give at the age of 10 to 16 years, which is in form of a PD vaccine. In pregnancy also, we give 2 doses of this vaccine. Okay. So these are the 2 doses of tetanus we give 4 weeks apart. Okay. So this is a revised national immunization schedule we do. Okay. It is revised recently because addition of a new vaccines like Rota, IPV, Penta, and all. Right? Also the MR vaccine. Now, strengthening universal immunization program mission in Indonesia, we do have increasing full immunization coverage to 90% and sustain it. Fine, then 690 districts covered in 9 phases, including the intensified MI, okay, mission Indra Dhanusha, and one of the flagship schemes under Gram Swarajya Abhiyan and extended Gram Swarajya Abhiyan. Right now, so reaching the unreached with all available vaccines. So our motto is to reach the unreached with all available. What all vaccines we have? With those all vaccines, we should reach the unreached. Now, intensified mission Indra Dhanusha, it is launched in October 17 to 2017. Okay. So in that, to ensure the full immunization in selected district and cities to more than 90% coverage by December 18, okay, against 2020 earlier. With the intensified mission in Dhanusha, we have preponed our target. Also, the 4 phases of the mission reached to 2.53 crore children and 68 lakhs pregnant women. Progress to be monitored at a highest level under proactive governance and timely implementation. Yes. Pragati. Proactive governance and timely implementation. Under this, we monitor the progress. Here you can see the first dose of this Indra Dhanusha given by our Honorary Prime Minister Narendra Modi ji. Honorable Prime Minister Narendra Modi ji. That is all regarding our IMNCI and vaccination. Okay. So in this lecture, what all you learned in nutshell, in a brief, um, let me show you what all you learn in today's class. So very important. First of all, what is newborn care? How to take newborn care? Their scalp, their nose, their mouth, breast and vagina, then their bathing, their umbilical cord, etc. Then how not to use most, how to use clothes, napkin and all. Then you learn regarding infant and young child nutrition, so which includes the nutrition of infant up till 3 years of age, along with the nutrition of pregnant and a lactating mother, with recommendations like into skin contact, exclusive breastfeeding till 6 months of age, complementary food, also the interactive feeding. So recommendations of this IY, same, which you all must know about it very well. Then is a very famous pie chart relationship between underfat mortality rate and malnutrition, which shows that 50% of mortality is because of the acute respiratory infection, diarrhea, measles, malaria, along with malnutrition. Underlying cause of this malnutrition is always seen. Then the effects of this malnutrition you all saw. Then low birth weight, KMC, kangaroo mother care. Then IMNCI, that is integrated management of neonatal and childhood illnesses. In short, what is that? Why the integrated approach? Because these five diseases are the major cause of mortality among under 5. So at a time, a baby is having more than one diseases of these 5. So if you have the integrated management, it becomes easy for managing the baby and also to decrease the mortality in this age group. So which you saw the advantages and all, then the single diagnosis is not easy with the symptoms. Component of this IMNCI you all learned. Difference between integrated management of childhood illnesses and integrated management of neonatal and childhood illnesses. You saw difference between these two. Then the packages you saw. In the flow charts, then facility-based IMNCI, where we improve, where we strengthen the capacity building of medical officers and also nurses, so that they can skillfully manage the very sick baby, okay, along with the normal management. Then training of this IMNCI you saw, then community-based IMNCI you saw. In that, what all we do? Key family practices include promotion of growth and development. G and D means growth and development child, then disease prevention, then appropriate care at home, care seeking outside the home, then IMNCI plus. That is all. Also, the national immunization program, you all learned the basic immunization, also the new added vaccines you saw. Then Mission Indra Dhanusha, also the intensified Mission Indra Dhanusha. That is all regarding today's lecture. Thank you very much, all of you.